The diaphragm is a birth control device that prevents sperm from entering the uterus. It is a small, reusable rubber or silicone cup with a flexible rim that covers the cervix. It is prescribed by your doctor and costs between $0 and $75. Before sex, the diaphragm is inserted deep into the vagina so part of the rim fits snugly behind the pubic bone. The diaphragm blocks the opening of the uterus and stops sperm from moving. The diaphragm is effective at preventing pregnancy only when used with spermicide cream, jelly, or gel. Most spermicides contain certain risks. If used many times a day or by people at risk for HIV, it can irritate tissue and increase the risk of HIV and other sexually transmitted infections. You can make the diaphragm more effective if you make sure it covers your cervix before each time you have intercourse. Make sure spermicide is used as recommended. Your partner can help you make the diaphragm more effective by using a latex condom or pulling out before ejaculation. Keep in mind that the diaphragms do not protect you from STIs. Use a latex condom to reduce the risk of infection. Most women can use the diaphragm safely, but some conditions may make it difficult or impossible for some women to use the diaphragm. The diaphragm may not be right for you if you are not comfortable touching your vagina and vulva, are sensitive to silicone or spermicide, have given birth in the last 6 weeks, have certain physical problems with your uterus or vagina, have difficulty inserting the diaphragm, have frequent urinary tract infections, have a history of toxic shock syndrome, have poor muscle tone in your vagina, recently have had surgery on your cervix, or recently have had an abortion after the first trimester of pregnancy. Your diaphragm should be used by you and only you. Do not share with friends, and do not ever use someone else's diaphragm. Most women can use a diaphragm with no problems. Serious problems are very rare, but some women may experience some side effects. Those who use diaphragms may develop frequent UTIs. To avoid infection, you can urinate before inserting the diaphragm and after intercourse. If you get frequent bladder infections, ask your healthcare provider to check to see if your diaphragm fits correctly. Some women who use diaphragms may develop vaginal irritation. This can be a sign of sensitivity to silicone or spermicide. If you have a mild reaction, try switching brands of spermicide to clear up the problem. If that doesn't work, stop using the diaphragm until you speak with your healthcare provider. Check with your healthcare provider if you feel a burning sensation while urinating, are uncomfortable when the diaphragm is in place, have irregular spotting and bleeding, feel irritation or itching in the genital area, have redness or swelling in the vulva or vagina, have unusual discharge from the vagina. These symptoms may be a sign of infection or other conditions, but most conditions are easily treated. Diaphragms come in a variety of sizes. Your healthcare provider will fit the diaphragm and demonstrate how to insert and remove the diaphragm. Instructions on how to use the diaphragm. First, wash your hands with soap and water. Put about a tablespoon of spermicide in the cup while spreading some around the rim. Find a comfortable position. You can lie down or squat. Separate the lips of your vulva with one hand, pinch the rim of the diaphragm, and fold it in half with the other. Place your index finger in the center of the fold for a firmer grip. The spermicide must be inside the fold. Push the diaphragm up as far back into your vagina as possible. Tuck the edge of the diaphragm behind your pubic bone. Make sure your cervix is covered. The diaphragm does not offer reliable protection from sexually transmitted infections. An estimated of 16 out of 100 women will get pregnant in the first year of typical use of the diaphragm. Consistent and correct use is essential for the effectiveness of the diaphragm. For example, you may get pregnant when using the diaphragm if you don't use the diaphragm every time you have sex. The diaphragm becomes dislodged from the cervix during sex. You don't use spermicide. You remove the diaphragm within 6 hours after having sex. Spermicide applied to the diaphragm may damage the cell lining in the vagina, causing an increased risk of STIs, vaginal irritation, urinary tract, or vaginal infection. Contact your health provider if the diaphragm slips out when you walk, sneeze, cough, or strain. You notice blood on the diaphragm after you move it that isn't related to your period. You or your partner experience pain during or following use of the diaphragm. You have signs of symptoms of toxic shock syndrome, such as a sudden high fever, diarrhea, dizziness, vomiting, fainting, or a rash that looks like a sunburn, or you are unable to remove the diaphragm. In all, diaphragms, if used correctly, are an effective form of birth control. However, diaphragms do not protect you against STIs or other diseases.